I'm Carolyn Beauchamp. I'm the president of the Mental Health Association in New Jersey. Tonight we're celebrating our 75th anniversary. Mental Health Association began in the 1940s when Clifford Beers, an ex-patient, came out of an institution and believed that he could make a change so that people in these institutions could find their freedom in the community. What got me involved with the Mental Health Association in New Jersey was a search that I went on after working for about 11 years in a community mental health center for an organization that was really strong in advocacy and policy. My feeling was that if you wanted to create substantial change, you really had to change at a legislative level, administrative levels, and the Mental Health Association has always been a very strong advocacy organization. I've worked with the Mental Health Association in New Jersey for more than 35 years. I stay as involved and as proud and as excited about it because we have a really remarkable workforce. We have a core of people who are very invested in the advocacy work that we do, and they're excellent at what they do. It's really my work family.
My name is Mike Lee Otis. I am the Recovery Training Coordinator for the Mental Health Association in New Jersey in Ocean County. How and when my mental illness manifested was in January 2011. I had my first major mental health breakdown. I became paranoid, I became fearful of everything. It was just a nightmare that I hope I never have to relive again. Well, the Mental Health Association in New Jersey helped me with the support groups that they had in Ocean County, and it changed my life. It helped give me structure again. It helped give me peace again, that I wasn't alone, that there were other people who understood what I was going through. And I think the biggest thing it gave me was a sense of community, that I belonged somewhere again, and that I could get better because there were people in the room who had gotten better. And so I was invited back to share my story, and they hired me on the spot. And it was what I wanted to do, so they've helped me not just rebuild my life personally, but get into a profession that I could help people who had been through what I had been through and play the same role that MHANJ played in my recovery. I do a lot of things, from run support groups to run curriculum groups such as the Wellness Recovery Action Plan, which is a self-identification tool that lets you be the expert on your recovery.
The use of the peer recovery model, I think, has been one of the most effective interventions we've had with substance use disorder, at least in our system. The scope of the peer recovery program has just grown tremendously. Each year now, we're serving about 20,000 patients in our hospitals with just over 100 peer recovery specialists. It's really helped us address and I think begin to really eradicate the stigma of substance use disorder, and it's been, in many ways, nothing short of a miracle. The Mental Health Association of New Jersey is a critical advocacy voice in New Jersey. Particularly under Carolyn's leadership, she's made it clear when she's educating other policymakers, legislators, any of us in New Jersey about the importance of not only the voice of the consumer, but also the voice of the family. And so for that, I think we owe the Mental Health Association of New Jersey really a debt of gratitude to help eradicate the stigma around these diseases and advance people's wellness and recovery.
There is always more progress to be made. There are always things that have to be changed. I think for the Mental Health Association, as I think about the future and where we need to go, we need to keep expanding the peer empowerment movement. We have to bring mental health and substance use disorders as part of physical health care. And it's very important that we educate families, that we give them information, and that we're clear that they are a part of this wellness and recovery.
For decades, the Janssen pharmaceutical companies of Johnson & Johnson have pioneered the development of groundbreaking new treatments to help people with mental illness live better and healthier lives. The vital mission of the Mental Health Association in New Jersey is both close to our hearts and close to home here in Janssen's home state. Your mission to achieve victory over mental illness through advocacy, education, and services closely aligns with Janssen's own approach to healing minds and restoring hope for better lives. Together, we will write the next chapter in mental health and well-being. While we have made headway in treating mental illness, lack of treatment access and negative perceptions of mental illness still prevent people from getting the care they need. Raising awareness is the first step to overcoming these roadblocks and helping people live better and healthier lives. We are honored to be recognized for our commitment to the research and development of medications for those who need it most, and for our long-standing support of the Mental Health Association. Tonight's honor is both a celebration of our partnership and a reminder that our work is not done. I know that together we will continue to meet the needs of people struggling with mental health issues. Thank you.
I want to thank everyone for being with us this evening. I want to thank you for your support. I want to particularly thank our staff. We have amazing, wonderful staff who have worked very, very hard on our issues. Tonight, they are here, many of them are here helping out. I want to thank our development team, my administrative team, certainly my board of trustees, all of our volunteers for taking such an active role with us and helping us really get to our goals in a very, very strong way. Thank you so much.